People often perceive liver cirrhosis as just a consequence of heavy drinking, but in reality, it's a complex and multifactorial condition that can arise from various causes, including chronic viral hepatitis, fatty liver disease, and autoimmune disorders. To understand liver cirrhosis, you need to know that it occurs when the liver is repeatedly damaged over time, leading to the formation of scar tissue. This scarring prevents the liver from functioning properly and can result in a range of complications, including liver failure, portal hypertension, and an increased risk of liver cancer. Chronic alcohol consumption, viral hepatitis, particularly hepatitis B and C, non-alcoholic fatty liver disease, NAFLD, and autoimmune hepatitis are among the primary causes of liver cirrhosis. Now we are getting close to jumping into today's topic, but to give you some depth, we will quickly go over signs and symptoms so you can follow along when we get to how you can live with this condition optimally. Okay, now liver cirrhosis often develops slowly over years or even decades, and symptoms may not appear until the condition has progressed significantly. Common signs and symptoms of liver cirrhosis include fatigue, weakness, jaundice, yellowing of the skin and eyes, easy bruising and bleeding, fluid buildup in the abdomen, ascites, confusion or difficulty thinking, hepatic encephalopathy, and swelling in the legs and ankles. Drop us a big like if you are enjoying the video. Okay, now let's dive in as promised. But how do you manage liver cirrhosis so you get the best shot at living with the condition? While there is no cure for liver cirrhosis, several strategies can help manage the condition and improve quality of life. First off, there needs to be some lifestyle changes. Adopting a healthy lifestyle is essential for managing liver cirrhosis. This includes abstaining from alcohol consumption, maintaining a balanced diet low in sodium and processed foods, exercising regularly, and avoiding smoking. Next is medications. Your doctor may prescribe medications to manage specific symptoms of liver cirrhosis, such as diuretics to reduce fluid buildup in your body's cavities like the abdomen, medications to lower blood pressure and prevent bleeding from enlarged veins, varices, and treatments to manage underlying causes such as antiviral medications if the underlying cause is hepatitis B or C. Then, to make sure that you are on top of your health journey, you should get regular medical monitoring or checkups. Because people with liver cirrhosis require regular medical monitoring to assess liver function, screen for complications, and adjust treatment as needed. This may include blood tests, imaging studies such as ultrasound or MRI, and liver biopsies to test for liver cancer. Now the next step is management of complications. Depending on the severity of liver cirrhosis and whether or not complications are present, additional treatments may be necessary. These may include procedures to drain fluid buildup, paracentesis, banding or sclerotherapy to treat varices or bleeding blood vessels, or even liver transplantation in cases of advanced liver failure. Now, living with cirrhosis may not be easy, so emotional support is important. Living with liver cirrhosis can take a toll on your emotional well-being. It's essential to seek support from friends, family, support groups, or mental health professionals to cope with the challenges of the condition. So in conclusion, while liver cirrhosis presents significant challenges, it's possible to live a fulfilling life with proper management and support.